Thanks, Alex, so much, and welcome back. You may remember Alex was working very closely with our pandemic efforts for the first year and a half, and is now coming back to help again. And she's right, we're trying different approaches to the press conference. We want to make sure you have time to voice your questions and for us to answer them. And that's really important. You've been really important partners to us throughout the pandemic, and we want to give you the information you need to meet the needs of your readers, listeners, viewers. And so we're doing something a little bit different today, and that is I am going to be sharing my screen. And this is against all odds. I'm very familiar with the scientific data that shows that men are incapable of multitasking, but I want to walk you all through a couple of web pages today. And so that's the reason I'm going to attempt to do this. But rest assured that if I stumble, Brianna has the slides as well, and she'll be ready to jump right in. So our first slide is just an update. How are we doing? And this is sort of everything we used to tell you in 15 slides, all in one slide. So I'm going to take a few minutes. I think the cases yesterday were 1,809, and we've kind of come to the point in our pandemic history where we think 1,809 is a relief. So there's something to that. If you look to the case curve to the right, you can see we're at about that level, a little higher in the middle of the worst crisis in our hospitals back in 2020. But we're coming down fairly rapidly, which is what we've seen across the world with Omicron. Very rapid ascent, upward part of the curve, very rapid descent. We welcome it. Another thing I wanted to mention is Mike Edwards, our lab director, had plotted out all the genetic sequencing data for strains in New Mexico and made the observation that we see a new major strain every 6 months. So just to review, we saw Alpha strain first hit New Mexico, December, January last year. And then we saw Delta hit New Mexico, July, August of last year. And then we saw Omicron 6 months later, again, December, January. And so I'm kind of hoping that holds out, and that maybe we're all going to get a little bit of a spring break with that low case count. You can see what the CDC considers to be high spread rates as anything above this red line, which is now incredibly low to accommodate this high number of cases. And so I am really hoping. We don't know where we're going to land. We hope we get a break. We did not get a break after Delta. Here, we just shot into Omicron, but I'm hoping we see that break in the every 6 month cycle and get a little, as I like to refer to it, a little bit of a spring break. Hospitalizations declining over the past week. And our hospitals, more important than what the numbers show, our hospitals are telling us two things. Number one, a lot less people in ICUs with COVID. And two, we now have rural hospitals who are reporting they have no cases of COVID at all. And that's been a really long time since we saw that. So we are getting some relief for hospitals. For them to get a real relief and give people time to take vacations and take time off, this case curve has to come way, way down. But at least we're headed in the right direction. And again, more good news for the hospitals. I mentioned this last week, but we're only seeing about a 1 week lag in the case curve between cases and hospitalizations. You remember up till now, it's always been 2 weeks, which means that the hospitals get their relief even faster, sooner. So we're thinking next week is going to be a really good week for hospitals as the number of cases decline. Now, Jared Ebenreck from KUNM News asked a question I wanted to cover here about whether Omicron is less serious or not. And I think we now have data in New Mexico that it is indeed less serious. That information about less people in the ICU, we're seeing a lower percentage of people on ventilators with COVID than we've seen since the beginning of the pandemic. And we're also seeing a drop in mortality rate. Overall, the mortality rate has been 1.6, but because of the lower mortality rate we're seeing with Omicron, it's coming down. Now, there is a 6 week lag there, so we have to be mindful of that. But I think we all agree that similar to other countries, and despite the very significant differences in demographics, age distribution, race, ethnicity distribution between, let's say, New Mexico and South Africa, we're seeing those same indicators of a lower level of severity. And so I'm real happy about that. I think this gives us a perfect time to continue our conversations about learning to live with COVID and transitioning to a new model of fighting the pandemic that occurs a lot more in our homes and in our families than it does in the halls of DOH and the Capitol and HSD. And so I'm excited about that. And of course, you'll hear more about that today as well. Vaccines, over 90%, as we were last week, and over 75% with primary series, over 91% with at least one dose. And we're, of the people eligible for a booster, that means they got their primary series more than 6 months ago, or 5 months ago, excuse me, for Moderna and Pfizer. We've already vaccinated 62.5%, which I believe from my woodworking that I do as a hobby is exactly 5/8 of the eligible people in New Mexico. Just those, for those of you who are missing your middle school algebra, I thought I'd throw a fraction in today instead of a decimal point. I think that's mostly what I want to cover on this slide, and I'm driving today. Interesting article this week about the effectiveness of boosters in the New York Times. Just wanted to highlight that. They extracted some CDC data. Average deaths per 100,000, 7.8 in folks who were vaccinated. And I did the math on this, but I forgot to write it down from my calendar. So it's 13 times greater chance of dying from COVID in the unvaccinated than the vaccinated without a booster, and then 6 times higher from that group to the ones with a booster. And so again, just quickly with my calculator, 78 times more likely to die from COVID. I guess I could have done that in my head. If you're unvaccinated than if you're fully vaccinated and have that booster on board as well. The combination of fully vaccinated with a booster is now what we call up to date. And we're not referring really to fully vaccinated anymore, even though I just did. I'm trying to get out of that habit. Rapid test distributions in the news. As of today, we've ordered 3 million rapid tests for New Mexicans. So far, we've gotten 1.8 million of those. We've already gotten 1.4 million out the door. Here in the map to the right, and I'm going to show you where you can find this information online, is the numbers of thousands of tests. So to pick Lee County down in the lower right-hand corner of the state, southeast corner, 81,000 tests delivered there. And you can see these are fairly proportionate both to population and to also proportionate to high social vulnerability, which equates with low income. So we're doing 2 tracks of this to try to ensure that those highest risk people who have twice as many cases of COVID and 2.5 times as many hospitalizations and deaths per capita are getting extra supplies to use. We anticipate that the remainder, the 1.2 million that aren't in the state so far, should be coming throughout the next 2 to 4 weeks. And we will start updating this information, and we can tell you every week, but we can also update it on the website I'm going to show you. Working with our website partners, Real Time Solutions, we've been very happy with their work, and this website was actually even updated this morning. And so I'm going to take you to that website. It's actually, this is not it. So let me open that website. findatestnm.org. It'll take you here. And can you guys see my screen? I don't think you can see the website. So let me try this.
I saw it, David.
Oh, the website? Okay.
Yeah, I saw
All
it.
right, good. Because what was on my other screen was different, was the slides, but that's fine. So here's the website. And I'm going to show you a special feature for reporters, basically only here at the end. But you can go in and it says, I want to test. And so first step is you enter your zip code. And I thought we should do one urban and one rural. So let's do 87102 in Albuquerque, downtown Albuquerque, here, and you click Find My Test. And then you've got choices, like I'd like to mail order a test, and there are a couple options there. I'd like to pick a free test. I want to test today, but I don't want to wait in a really long line for a PCR test, and I'm not, I don't have symptoms, so I'd like to do that. So if you go here, you can see here, there's some mail order testing options here, and I'll give a plug again for the federal one. This is a program that we're doing with the Rockefeller Foundation for high SVI, low income zip codes. But let's just say you want to pick one up. You live in 87102, you click here, and you scroll down, and what you see is all the different sites in New Mexico with the hours that you can pick up home test kits. And so you can see we picked a high population zip code to start with, quite a few choices. You can figure out which one you want to go to, what hours fit for you. These are not all day locations, as you can see, although some of them are open 24/7, some aren't. So these are where the tests are right now in your community. And then someone inevitably will say, well, wait a minute, not everybody lives in Albuquerque. What if I live in Hobbs? Now what do? You type in your zip code, you click on Find My Test. I want to pick them up. I don't want to wait. And then again, two choices to have them delivered to your house, and they take you to those websites. And then you can go to the MLK Soccer Complex in Hobbs during these hours, Monday through Friday, and pick up those home tests. And we're really encouraging New Mexicans to order the federal tests. I'll speak to that in a minute, but also to pick up home tests. We want everyone to have a supply for when you need them, because this is part of learning to live with COVID, is to have the tools to fight COVID right in your own home without even having to leave your house. Now, for reporters, I want to show you county allocations on this page. One, you're going to want to, of course, use this website finder to publish the locations in your communities where tests can be obtained, but also to get the number that have been allocated to your county. You can see the different numbers. It's quite a long test. So again, just to use the Lee County example, I could use another one too. You can find the number of boxes and actual tests that have been distributed so far. That will be higher, of course, in high SVI zip codes. And we'll continue to try to keep up the best we can with demand. Our county managers now, emergency managers, letting us know what their supply levels are, and we'll be able to inform you of those as well. So let me see now if I can get back to my own PowerPoint presentation. Here I am. Thanks. Who said men can't multitask? Actually, I say it every day. All righty. So that's how to find tests. You're welcome to explore other areas. If you find bugs, let us know. And also, there are some counties where we haven't gotten reports just yet on distribution. And in those situations, we give you the county office to call to get more information as they all get up and online. So that is how to find a test delivered to your home. And then my plug that I did, I don't know why I like holding these boxes up next to my head, but I really do. We would love to have 4 million additional tests here in New Mexico. You know, we have over slightly under 1 million households. Every household could get 4. It can really help us manage this pandemic at home if you pick up these, if you order these tests. I had our whole team order them immediately. Almost everyone has gotten one now. And so it's not that long of a turnaround. They've done a great job mobilizing the Postal Service and their shippers to get these done. But the idea is not to wait until you're exposed, or not to wait until you need that kind of test when you don't have symptoms. The idea is to have those in your home so you can just do them. And just, I'm not making this up. This morning, my wife came in and said, I need one of those tests because I got to go to my mom's house and test her. And so we had a different kind of test I gave her. She went, She tested her this morning because she'd been exposed 5 days ago and she was negative. So that was reassuring. So that's what's happening now. I feel like I want to thank all of our partners, our emergency managers in every county, our folks in DOH, Billy Jimenez, one of our deputy secretaries heading up this effort, all the folks on the HSD side that are now working to find ways to directly mail these to New Mexicans' homes who are at especially high risk as well. So I think we're doing pretty well. I think we're ahead of the curve. Talking with some people nationally today about how we were figuring this out. And once again, New Mexico kind of leading and figuring out, not just waiting for the federal government, but providing the people of New Mexico with the equipment, the materials, the tests they need to fight the pandemic in their own homes. The next feature of the day I wanted to do is we're going to be moving more and more of the daily reporting into weekly reporting. And so I wanted you to, I thought each week I could just show you a report. Alternatively, we could just have Julia Goldberg give this tour, but I didn't think of that till just now because Julia is one of the people who goes in there and does that. And so I'm going to take you back to the web page here. Just a second. I did not rehearse this. And if you go to the DOH standard website, and I use some shortcuts, but I'll show you how to do it when we get there. If you go to the DOH website, you'll see this on the top. You go to medical and scientific reports, click epidemiology reports. That takes you to this page. And I'm going to open one of the reports. We don't have time to go through every piece of data on here, but I want to hit some of the high points. So you'll see the cumulative total of hospitalizations, people admitted to the hospital, the total number of admissions to the hospital, which is different than people in the hospital because some people stay longer than 7 days. And then the mortality rate in the hospitals, which is slowly coming down from, I think, a high of 23%. But there are other really good graphs over time, new hospital admissions to give you a sense of where we've been. And this really tells the story about the fact that our hospitals have not really had any kind of break whatsoever since early January last year. I mean, it's been really, since early August last year. I apologize, it's August. So it's been brutal. And so we're hoping this curve drops as well. I won't hit every page. Here's an interesting one that I followed that gets to Jaron Ebenbrecht's question about, is COVID more severe? These are the number of people in the hospital who are not on a ventilator. The green are those who are, they add up to this total. And we look at this ratio, the percent of people in the hospital on ventilators, as an indicator of the severity of disease. We had a brief period back in May where it was low, but with Omicron, we've seen this dip quite a bit. In fact, one day last week, it was as low as 9%, which was the second lowest I think we've had. So another that you can get some insight there. I hate when people scroll through slides. It makes me dizzy, so I'll stop quickly. We used to get this question a lot. How many people are admitted from within New Mexico and outside New Mexico? You can see it's an extraordinarily small number of admissions from outside New Mexico. When we do see them, it's during big surges and like we had back in October, but continuously low numbers. And then lastly, going really quickly here, I like this graph as well. It's one that you can use. You asked us a lot of questions in the fall about the flu. Are we seeing more of the flu? And you can see we had very little flu, the green line, the green dots, all the way through the major part of the pandemic. But now that people are out and about more, less people are wearing masks, more people are doing air travel, we're seeing a parallel uptick in influenza that also is paralleling. It kind of almost is proportional, maybe half of what we're seeing with COVID cases. So that's really the end of the epidemiology report of the day and of the week, I mean, and I'll go through others as well. But anytime you have a question about anything on the report, just contact our comms people. We're happy to reach out and get those to you. So in summary, we are officially on the downslope of the Omicron case curve. We don't know how low it'll go, whether we'll have a plateau like we did with Delta. We're just not sure yet. we'll have more information. Boosters clearly work. Please be one of the 3/8 of the population who's eligible for a booster, who goes out in the next couple of weeks and gets it. We talked last week about masks, and we'll have more on that next time. And then let's get at least a minimum supply of COVID tests in your home so that you can be ready in the almost certain event that sometime in the future. Hopefully we have a break, but I think the pandemic is going to be with us for a long time. Be ready so that when you need to have a test, like my mother-in-law did this morning, that you, or in this case, your daughter-in-law, has that test available and can come over and administer it. And with that, Alex, I'm done with my part, and we can just shift it over to questions now.
Thanks, David. Okay, we're starting to get some hands raised on Zoom. We're going to go first to Julia Goldberg with the Santa Fe Reporter, followed by Chris Keller with Albuquerque Business First. Julia, go ahead.
Thank you, Alex. Thanks, Dr. Schrace. I think I know the answer to this, but I just want to make sure I'm understanding. I don't know if you could go to the second page of the vaccination, the most recent vaccination report.
I can. Just give me 1 second there. Let me get there. Keep talking, and then I'll bring it up on my screen.
Okay. I just wanted to check in about the nomenclature, because you've mentioned more than once that you're now talking about being up to date versus being vaccinated or fully vaccinated, but the vaccination report still uses the vaccinated versus not fully vaccinated when breaking down the cases, hospitalizations, and deaths. And I report that number every day, and I've had increasing questions from readers who are like, how do the booster shots play into that percent not fully vaccinated? I checked with DOH, and my understanding is it's not calculated in there at all, but I just wanted to make sure that that is correct, and ask if you think that that will become part of that metric, so people have a sense of that as well.
Yes. And Julie, I think what we're going to do, and it's a great point. So number one, we'll make a note about not using the term fully vaccinated on this report and change it to primary series. So thanks for that catch. Second, the way I envision the report is we'd have an additional color. So we have unvaccinated, primary series, and boosted. And we have some preliminary data. I've asked some questions about it. Part of the problem is that there are different subsets of data. And so we're working with the epidemiologists to help them figure out, because they only like displaying things where they have exactly the same denominator. So I think in the coming weeks, I've been told that we will be able to add that third bar. This one will change to primary series only. There'll be another bar for primary series plus booster. And the data that I shared a little bit of last week or 2 weeks ago was very similar to the New York Times. 10 to 13 times higher here to here, and then another 6 to 8 times higher deaths in primary series versus primary series plus booster. So that is coming. It's important. And I think it's also a good marketing tool, I think, for the booster, which is why I'm interested in getting that online.
Thank you, David, and thank you, Julia. Chris Keller put his hand down, so we're going to go next to Brittany Costello with KOB, followed by Chris McKee with KRQE. Go ahead, Brittany.
Hi, thanks so much. Oh, wait, let me. Sorry, I'm on two computers. Let me move. Okay, this is better. So my question is just about the test kits. So I know you guys ordered 3 million. Do you think that's enough? Do you foresee needing to order more in the future? And then you mentioned that kind of stock that people should have just in case emergencies. How many tests do you think that people should have just on hand for whatever situation may arise?
Well, I have the same answer to both questions, and it's, I don't know yet. I think, one clue we have from the federal government is they ordered insurance companies to cover 8 tests per person per month. So that's one number. I think it's unlikely that we'll need those many tests, but we've estimated a start of 3 million, and then we're going to be monitoring use, and then ordering will be driven by how much people seem to be using and picking up at these sites or ordering online in the state when we have that. So I think the answer is we don't know. I think it's a minimum of 4, which you can get, a minimum of 4, which you can get from the federal government. Remember, they only take 15 minutes as opposed to taking time off to go to a site to get a PCR test. I would say a minimum of 4. I think if you had 4 from the state and you picked up, 4 from the feds and you picked up another 4 from the state, that should last most people much longer than a month. But we'll be doing those calculations. It's sort of exactly the same problem as when you introduce a new product in the market and you don't know what the demand for the product is going to be. So you have to monitor daily sales in order to figure it out. And we're doing something very similar here. So we'll know. I think I would just encourage people a minimum of 4. Why don't we say every family should have 4 to 8 tests total, and then we'll go from there. And when we know more, we'll let you know. And Alex, I see you saw Chris, so he is next.
Yes, and that's Chris Keller, followed by Chris McKee. So go ahead, Chris Keller.
Thank you, Alex. Thank you, Dr. Scrace. As always, happy Groundhog's Day to both of you. I think I understood what you said towards the tail end of your presentation about moving away from daily figures to weekly figures in order to combat some of the squishiness that daily figures can show. The data that's contained in the epidemiology reports, has there been any discussion about making those raw data points available, just in whether it's a downloadable CSV?
Oh, yeah.
Specifically, like the specimen collection figures that make up the 7-day average, the daily hospitalizations, kind of maintaining that so that it's available in a format other than the PDF charts. Thank you.
Yeah, that's a great question. And we don't intend to get rid of all daily reporting. So thanks for clarifying that. I didn't mean to say that. I think, though, that what you see in the daily epidemiology report represents probably 200 hours of work of epidemiology staff per day, cleansing that, deduplicating, coming up with the best version they can to smooth out that variation. But as you all know, since the beginning of the pandemic, we have less cases on weekends. And as you also all know, the virus doesn't take weekends off. It's just people getting tested, reporting, things like that. So we will actually probably provide a little bit more raw version of that data. And for things like hospitalizations, there's a national discussion going on right now about this. And there's with one of the things we've learned from Omicron is the case counts don't tell the whole story. And the real thing we should be concerned about is hospital staff, hospital beds, ICU beds, and the like. And so there's a lot of discussions at the CDC and public health organizations around the country to moving to more of the serious, what they call serious disease version of COVID. And so we're looking at that as well. But we will make things available. But when you subtract the 200 hours of epidemiology time, that will make the curve more bouncy, if you understand. But then those programs that run the weekly reports do all the deduplication of tests and case reports and things like that to give more reliable trends. We at the state don't actually use the daily data to make decisions. I'm trying to think if we ever did, but we know it's of interest to the public, and we will find a way. And actually, we'll work with you to figure out a way to more simply make that more simply available, probably just on the web at a certain time of day, if you think that would work.
Okay, thanks everybody. We're going to turn over to Chris McKee, followed by Jared Ebenreck at KUNM. So Chris, go ahead.
All right, thank you very much. Hello. I wanted to just kind of get a little bit more of, this is kind of the obvious summary question, I feel, but just to ask it, are you encouraged at this point at where things are going with this Omicron curve? And maybe why is it also that we can't really tell exactly how far this would go down? If maybe you can elaborate a little bit why on it's harder to tell how far this might go down.
Yes, well, I'm very encouraged. I don't think you've ever heard me talking about getting a spring break on these press conferences after 2 years. And so I think we're going to get, especially compared to what we've been through the past 4 weeks, a significant break. And I think our hospitals are going to be able to finally give people time off. They're going to be able to, go back to one hospital bed per ICU room, I'm hoping. So I'm very encouraged. And I think the reason we don't know for sure is we just don't have enough data about other places that are just like us. I think England works pretty well, but obviously we have different race, ethnicity balance in our state than they do in that country. And so, and other countries aren't far enough along. We saw the curve go way up there. We saw it come way back down and then level out. But I don't know if that's going to level at less than 10 cases a day, Chris, which is that little tiny space below the red line, or 20 is just too early to tell. And our modelers are good. And I don't know if you remember this, but we told you that we would see that peak right around the, the last 2 or 3 days of January, the first 2 days of February. We told you that 3 weeks ago, and they were spot on, but it's hard to see out beyond that. And so, and then the other obvious, things that play into that as well. It's great that we've had a 6-month period between major variants, and Omicron going up and down so fast gives us more of a in-between time. But that doesn't mean there's not another variant waiting in the wings that will, like Omicron did. And I might actually, if I can find it quickly enough, go back and show that slide, because I think I'm going to do it. I think it's illustrative of why we don't know. And I think you can see a slide now, and hopefully you can see a bigger slide. This was Delta. And at first we thought, oh, we're on the downturn, but then it persisted and it went up even more. And then we thought, well, maybe we'll get back down to the red line or below like we were before Delta. And then Omicron intervened because Delta lasted longer than the 6-month period we like to allow variants. So we don't know if we're going to be in a situation like this or in a situation like this in another 4 weeks. And I think I should underscore too that while I'm enthused about the future, it doesn't mean that it's time to take off masks or be less serious or rigorous about testing, because we still have 1,800 cases a day, which is about as high as it's ever been other than this peak. So indoor spaces with masks off, still highly dangerous, still seeing outbreaks, groups of people who've been indoors together at events. And so everyone still needs to be careful. But yeah, I'm optimistic, enthused. And, I got to tell you, I got people, our epidemiologists and public health people, and a lot of different state departments who they need a break too, in addition to our provider network across the state.
Thanks, David. Jared is the only one that has their hand up. And so this is just a final call for any other of our media partners to ask a question before we go on to a second round, time permitting. So Jared, go ahead, please.
All right, just confirming you can hear me.
Yep.
All right, thank you so much, Dr. Scrace, for the time. Jared Evanreck with KUNM. Thanks for addressing the questions earlier. I just wanted to parse out a little bit of a nuance that I think I'm discovering in the coverage around Omicron being mild. There seems to be a confusion about it being mild for the clinical definition of mild versus what the subjective experience is of the patient. And the journalistic question is, what role do you think reporting Omicron has as mild whether relative to other variants or not, has played in this current wave. One suggestion could be that people are confusing the clinical mild from the subjective mild and the highly dangerous transmission of a still very potentially severe infection from Omicron. So I'm trying to parse that out, the difference between the clinical mild and the subjective experience of it, since I know many people suffering with it, and they don't say it feels mild.
Yeah, and so that's a great question, and I appreciate the opportunity to address it because I think it's caused a lot of confusion. And there's two ways I want to talk about it. One, when I or one of our epidemiologists talk about mild COVID, that all that means is you're not in the hospital. You're not hospitalized. That's what mild COVID is. There's mild COVID, and then there's being in the hospital. And of course, there's being in the ICU and being intubated. So mild is everything up to, I had one of my folks I work with very closely in the ER last night, for hours and hours with possible pneumonia. And under the definition that you see in the media, that would be considered mild. And so, and of course, if you're 22 and have no medical problems and you're healthy as you can be, and you get COVID, maybe that's mild. But if you're 80, you get that same Omicron strain, it can still kill you, and we're seeing deaths in people from Omicron now. So that's like the individual level, and then there's the societal level, because if something is half as bad, but you have 3 times as much of it, that's 50% more bad. That was really bad grammar. My mother, were she alive, would probably appear and make a comment. But so it's like half as bad, 0.5, 3 times the frequency, 3 times 0.5 is 1.5. And that's what our hospitals are seeing. They are seeing less sick people. They're seeing shorter lengths of stay, but they're flooded. I mean, they've been swamped. And unlike the last round in November, December of 2020, they were already full with other individuals. And so there's 2 aspects of that. The people I know, like the people who've had COVID, I would not describe it as a physician as being a mild disease. But if the definition is not being in the hospital, then I would have to admit that, boy, they were really, really sick, but at least they didn't have to go to the hospital. So yeah, if people are just thinking they're going to get a runny nose for a day and a half and they'll be home free, that is not what most people are experiencing. It still is all my friends. And I think, as I say, my friends, I think we're all in the position today of knowing more people who've had COVID in the past month ourselves, knowing them, than we've known in the whole pandemic up until the past month. And my experience, Jared, is the same as yours, that the people I know, they're not still doing Zoom meetings all day the next, for a couple of days. They're on their back in bed, drinking fluids and, looking to recover. So thank you that's a really important fine point. And I think it's been misunderstood amongst the general public.
Thank you, David. I'm going to turn over to Algernon Damasa with the Las Cruces Sun News for a question.
Thank you. Thank you very much. Last week, I spoke to some hospital leaders, including some at hospitals that are operating under crisis standards of care. And one thing they did speak to me about, though, was that they anticipated continued pressure due to large volumes of non-COVID patients, patients who have either deferred care or diagnostic testing. So they're actually anticipating that the break might be mitigated by that. And I'm wondering if you could speak to how hard that is to model and what you anticipate as far as being able to climb down from the CSC footing. Thanks.
Yeah, that's a really good question too. I love that you guys asked me stuff that I think, oh, I wish I would have thought of that before. But remember that curve I showed you of COVID visits to the emergency room and influenza-like illnesses to the emergency room? That's an added factor. We have some percentage of those people with influenza and COVID get admitted to the hospital. We didn't have influenza last year. That adds in. You mentioned the deferred care, certainly seeing a lot of that. And then there's 2 kinds of deferred care. It's like, well, I was going to get my knee replacement, but I think now I'm going to wait till after COVID is over. I don't need a knee replacement. I was just using that as an example. And then there's other kind of deferred care, like I was scared to go see my doctor, so I haven't had anyone look at my diabetes for a year and a half, and now I'm in the hospital because my blood sugars got out of control. And both of those kinds of deferred care are also at play. And then there's the fact that we don't have, enough hospital beds in New Mexico for any kind of situation like this. Normally, our hospitals are completely full, and I was just talking with our hospital leaders about that the other day. They're completely full during the winter, so that's a challenge as well. So the point's well taken. And when I'm thinking about a break, I'm thinking for hospitals, and it might not have come out that way, but maybe starting to see that 6 weeks from now, a week or two after influenza season goes away as well. But it'll depend on if there's another variant that comes through. But yeah, I did not mean to make it sound, and maybe I did, because I am excited for them to have a little bit of a break, to make it sound like they would all be on vacation at the same time. Their idea of a break is only one bed in each ICU room, and people being able to start taking a little bit of vacation time that they've accumulated over a couple years because they weren't able to get away. So thanks for underscoring that. I appreciate it.
Okay, we have only one hand left. So it's a final call for folks as we're getting close to wrapping up. Julia Goldberg, back to you.
Thanks, Alex. Dr. Scrace, I just wanted to ask real quick. I noticed that the most recent modeling report makes repeated reference to new Omicron-specific vaccines expected in March from Pfizer. And I guess I was surprised to see that a little bit, just because I was wondering, given that booster uptake is only around 40%, and with this thought of Omicron declining, I'm kind of what is like DOH planning to try to roll out Omicron specific vaccines in another?
Well, I think it's a little premature. We don't have enough information. Dr. Fauci was talking about this last week. I think it's like, from what I know about virology as a physician, which is some, not everything certainly, but some, it's silly to think that a vaccine that worked a year ago for a specific virus is going to be equally effective this year unless the virus doesn't change at all. And we've been over the case curve a couple times today, and clearly the virus is changing fairly dramatically. So it's the nature of viruses to mutate, and particularly respiratory viruses, which is why we get a new and different combination of flu vaccines each year when we get a flu vaccine. And so I think the uptake of boosters is 40% of the population, but it's 62.5% of eligible people for a booster. In other words, primary series more than 5 months ago. I'm just talking about the 2-shot vaccines now. And so I think it's still pretty good. And I think that's, 5/8 of the population that's sort of, I think, stepping up and saying, hey, I'm willing to do my part for the good of myself, which is fine, my family, which is fine, for the community, which is great. And so I still think we've got a big market, if you will, out there for people like myself and almost everyone at the Department of Health and most people in state government who want to stay up to date. And I think the question will be, does this virus ever settle into a winter respiratory virus like the others have done? And then, which would be great, because we may be able to get on a more annual vaccine schedule. On the other hand, if Dr. Ross was here, and she's not, she's busy preparing epidemiology reports, but if she was here, she would say, yeah, but until the whole world is vaccinated, we're going to have a struggle to really not be in an almost continuous cycle. Not the whole world vaccinated, plus the presence of international travel. So I think that gets to it.
Thanks, David. We're at 1:45. Do you have a few extra minutes if there are folks who want to raise their hand again for a final question?
Yeah, I think somebody had their hand up and put it down with some confusion.
That was Chris Keller, but then he asked his question.
Okay, perfect. Yeah, I have a couple more minutes if there's anything else.
I don't see any hands up, but we'll give it just a moment.
I would just mention too, we really appreciate your patience as things evolve here. We do have, we're bringing on some new people at DOH. I'm hoping I'll have either people to introduce to you next week or names to give you next week of a new communications and marketing. It's two different jobs, a communications job and a marketing job. And I've been really hard at work at that for obvious reasons. But we appreciate your riding this wave of change as we try to free up Laura and Christine to do what they need to do with vaccines, testing, and reporting. And I think we'll settle into some hybrid version of what we're doing with this, fairly soon after we get our new comms director on board.
It looks like we have one final question again from Jared from KUNM. And so Jared, go ahead, please.
Just seeing that you can hear me.
Yep.
Okay, thank you. Just wanted to note, I am seeing that this is live on social media today. And so just curious, will this format continue, a live social media broadcast as well as a press invite only format? Is that the basic format you'll move forward with the new communications director? And thank you for the extra time.
Yeah, thanks, Jared. I'm not going to make my goal of answering more questions that I do know the answer to than that I don't today, but because I feel like more competent when I can do that, but I don't know. And, my style of management is to let the new person come in, talk with some of you, get your advice, look at videos of what we've done in the past, and let he or she sort of put their own personal approach to it. And so I don't want to pin our future director down in any way, because I really rely on our comms folks, and Matt, when he was here, Jody, who's been with HSD since I got here, done an amazing job. I really rely on their instincts and what they tell me about comms. And I can guarantee you, if I designed this baby, you would not like it. So I just don't have those instincts. So I'm going to let that person take the lead, but we're jotting down your name now, and we will give it to them once we are ready to name, and we'll have them give you a call, and anybody else who's interested to get your feedback. How does that sound? I guess you can't talk anymore, so I'm just going to take that as an unqualified yes. And with that, Alex, I think we're going to wrap it up. Oh, he said sounds good. I think we're going to wrap it up. Again, we really need your help getting word out about testing, getting a moderate, not huge stockpile and not zero, but a moderate supply, the federal tests, pick up additional state tests depending on your need, your circumstances, your risk, your family size. Let's get ready, New Mexico, to really battle this virus from our living rooms and not from long drives in our car or from the departments of health. This is our chance now to figure out how to get the materials, equipment, supplies, everything we need within the confines and control of our own families to do what we need to do to manage the virus. We'll still have data for you, I promise. We'll still have those PCR sites going, but we think it's a much better use of New Mexicans' time and energy. And it's actually better for the economy if people can do a simple test or two at home and when they don't have symptoms, rather than having to take time off of work to get a PCR test when they don't have symptoms. If you have symptoms, get them. So I think we're on this journey together. I'd really like it if you all could get out the word about where in your counties and your service areas those tests are available. Point people for us to the link where they can see. And I still would like to make sure that New Mexicans, I feel like we have product placement now in these press conferences. We'd love to have every New Mexican household have 4 of these, 2 boxes, 4 tests on hand for the next 6 months. So with that, we'll end. Thanks for joining us on the next part of our journey. Don't take the mask off yet. Don't stop the rigor with testing till that case count gets much, much lower. But there really is good news today. And I think we're about to open a door to a whole new way of dealing with the virus and managing it here as we all band together as New Mexicans to keep not just the average New Mexican safe, but every New Mexican safe, and particularly our most vulnerable people. We all owe it to ourselves to protect those among us who are most vulnerable. With that, I hope you all have a good day and be super safe. I have to remember my acting director of the Department of Health role. Be very, very careful driving in the snow. Very careful. If you have a blizzard in your area, I talked to somebody who was going to drive from Santa Fe back to Albuquerque tonight and talked him into staying overnight in Santa Fe rather than risking that toboggan run down La Bajada Hill. And so be safe in the snow as well. Thank you very much and have a great day.